So, is he on any blood thinners? Any history of recent surgery or bleeding that you know of?
No, he's been very healthy so far.
So I think that your father may be having a stroke. You're just wheeling him into the CT scanner to confirm stroke and also to find out the cause of stroke if possible. If we find out that the stroke is because of a blocked artery, then he may be a good candidate for a clot busting medication. So for now, I would just suggest that you wait in the waiting area, and I'll update you shortly on all of this, okay?
Okay, thank you.
Okay,
My
thank you.
brother will be here any minute as well.
Sure.
Hello there, I'm Dr. Chu.
Hi.
Hi there.
This is my brother, Mark. What did the CT scan show?
He's having a stroke. There's a big blockage in a major artery in the brain, and there is an area of the brain that's dying. The good news is we've started treatment. We've started actually a study drug at this point. It's a clot-busting drug. In fact, he's been enrolled in a study, and the computer has opted for the TPA drug, which is sort of the standard drug that we give. It's a 1-hour infusion to help bust up the clot. The trial that he's started in is basically testing this TPA, which we've been using for a number of years, versus a bit of a newer drug called TNK, which is sort of a newer version of the TPA that's been used in the hearts for a long time. There's a lot of safety data on, and essentially the computer has randomized them to that arm, and so the drug has begun. And now we need to talk to you about the trial and explain it to you in more detail, of course.
Okay, that's a bit surprising that he was enrolled in a study. Did they talk to you about this at all? Isn't there usually a process to get consent before medication's given?
You're perfectly right. I mean, normally we would, and with an experimental therapy, we would always have to get consent prior to starting the experimental therapy, but basically in this circumstance it's a bit different because we're dealing with two drugs that are well known that aren't really experimental drugs. We're just trying to figure out which one might be a bit better. So we have something called deferral of consent, which allows us to initiate the treatment and to avoid any and all time delays. Essentially, either of these treatments work best if we start them immediately, as soon as possible, so not delay even minutes, because we can lose millions of brain cells in that delay, and we never want to delay any treatment. So we have a deferral process. But now that we've started, it's really important to go over things in great detail with you, make sure you're completely comfortable whether or not you'd like to carry on with the study with your dad.
Okay. All right, well, thank you for clarifying. Can I just ask, if this was your own father, would you have enrolled him in this study?
I absolutely would. It's a really important question we feel in the field right now, because we've got two treatments. One's a full 1-hour infusion, so it's a little bit more cumbersome to use, but it's the standard. The other is this sort of one shot and the treatment's done type of thing, which is appealing, but we don't have the same experience with it. So we really need to know, is this new treatment going to be equal or better? For example, is there going to be any differences in bleeding or safety with this? The data so far suggests that the new treatment may be as safe, if not safer. But we really need this, what we call confirmatory study.
Okay, all right. As you can imagine, this is a little bit overwhelming. My dad's having a stroke and now he's in a study. Is there anything that we can read about, or any materials, just to take our time and come up with any questions we might have?
Yeah, it's really important all your questions are answered. So essentially we've got an educational video you're welcome to watch if that's helpful, which goes through some of the details of the study and the participation, what's involved. And there's also an information pamphlet we can give you. But I'm more than happy to go through any element of the consent form in detail with you, of course.
Okay, well, thank you for treating him, and we appreciate your time.
Let's hope for the best.
Okay, thank you.
Good morning, nice to see you again.
Good morning.
Okay, I want to go through the CT results for your father that was done earlier today, and then I want to touch base to see if you have any questions about the study that he's enrolled in. So firstly, the CT is looking good. There's no signs of a large stroke or any bleeding on the brain.
Oh, that's good news.
We do need to do more of a specialized scan with an MRI brain that better assesses the extent of injury from a stroke.
So about that study, Mark and I talked about it. We also watched that video. So as far as we understand, that is in that trial, whether we consent or not, he got the drug, right?
That's correct. He got the clot-busting medication, further consent process would enable us to collect further data to better assess whether or not these two drugs are the same.
Okay, so I know Dad's not able to right now, but if he gets better, will he then be able to decide by himself?
So if he regains capacity, he'll be able to sign himself. In the meantime, you guys will provide the surrogate consent.
Okay.
Okay, well, thanks for the information. I think that sounds reasonable. So we'll be okay to go ahead with that, and hopefully Dad gets better soon.
Sounds good. I'll get you to sign right here.